since I was an employer back there on the North Shore, but certainly I can remember every quarter when the statements would come out, my partners and I would take a look at the rise in the premiums and start to sweat. And even as a member of the local Chamber of Commerce and on that executive board for a number of years, I remember collectively trying to deal with those issues. And we've been doing it for a long time. Harry Truman was, I think, the first president to start talking about health care reform in this country. And I think every single president since then has taken a stab at it. Richard Nixon had a plan. Jimmy Carter tried to have a plan. Bill Clinton had a plan all the way through. It still remains true today, and as employers, you know it as well as I do, that people really want some stability and security in their health plans. We have the whole issue of the uninsured, of course, but just as importantly, we have the issue of those people who have insurance, and small businesses trying to provide insurance, who just don't think they have the stability and the security. They worry about being able to afford coverage for their family. Their co-pays go up, the deductibles go up, the premiums keep going up. Fewer and fewer companies are able to afford coverage for their employees. Those that can't afford it are sometimes forced to drop it, or they're forced to change the dynamics in terms of their plan, so it makes it more difficult for both them and their employees to stay covered. About 45%, less than half of the smallest firms can actually afford to offer health insurance anymore. 60% of the uninsured are actually small business owners or workers, family members of those workers, about 28 million people. The costs keep going up. For small business, our costs have actually gone up over 129% between the year 2000 and 2009. If you're a worker, somebody that's employed by a small business, then you're paying 18% more in premiums than your neighbor who may work for a larger firm. And as you know quite well, if you're a small business employer, then the cost, the administrative cost for you could be as high as 25% of the premiums, whereas for a large employer, generally close to 10%. All that we're looking at down here, the proposal we're trying to consider, would change those facts. Small businesses under the proposed plans would be able to have policies that no longer allow insurance companies to exclude people because they have a pre-existing condition. They'd no longer be able to selectively refuse to give you coverage or renew your coverage. One of the people in my office has, I think, a great story along this line. Her husband owned a restaurant down in Reading. When their own child got sick, was born with heart problems, the insurance company gave them the choice. They would not renew their policy for the company because they thought the costs were too high because of this one child's incident. So they were forced to leave their own policy in order to be able to afford to cover their employees, and then have to take on an extraordinarily expensive individual policy for themselves. What the company didn't know is when they made the crack to the person who works in my office that they really weren't in the business of covering sickness, they were in the business of making money. They created a lifelong advocate for healthcare reform, and she's been doing a great job in our office. Companies under our plan are no longer going to be able to charge premiums based on gender or occupational pre-existing conditions. They're no longer going to be able to set unreasonable out-of-pocket spending limits. You know, right now, 60% of the people in this country that are filing for bankruptcy do so, at least in good part, because of costs incurred for medical problems. 85% of those people had insurance. They were either rescinded insurance partway through the claim, or their premiums, deductibles, co-pays were so high they just went into bankruptcy problems. Those things will stop under these bills. The health insurance exchange is going to be set up, which will allow for small businesses to have the option to buy their insurance from an array of companies that participated in this exchange. And there'll be forced competition here. What we've seen in too many places is that the industry is so consolidated that in many, many states, more than 29 states, 2 companies or less have over 70% of the business. They could use that power to negotiate a better deal with providers and pass those savings along, but what the study and the research shows us does not use that power for that purpose. What they've done is they've gone along with the increases, and then they've maintained their own profit margins, which have risen substantially since the 1990s. And so the one that ends up paying more premiums, more co-pays, more deductibles are the small employers and the employees in order to stay in the plan. You know, one of the things that we put in this bill and we're trying to fight to have it hold is a minimum loss ratio. Some of you may have heard me mention this before. When a company pays a claim, they refer to that as a medical loss. And for their shareholders, what they like to do is show them that they don't have too many paid claims, too many medical losses. And in fact, that a higher percentage of their money, their income, is being spent on dividends to shareholders, large salaries, and underwriting costs. In the 90s, about 95 cents of every dollar paid in premium would go to medical services, and the balance would go to dividends, salaries, and underwriting. Now, unfortunately, the studies show us that there are still some companies that are up at a good rate of medical loss ratio, but too many of them are down somewhere between 57% and 77%. Meaning that entire difference, instead of being 5%, that entire larger difference is going from inflated salaries to huge dividends, not just reasonable dividends that you and I would appreciate, but much more than that, and underwriting costs that are all too often just targeted in and keeping people away from coverage. Some of the salaries are incredible. The head of United Health makes so much money that if we took just his salary, we could pay everybody involved in the Medicare and Medicaid programs nationwide for 3 months. And Mr. Williams, the CEO of Ender out of Houston, Texas, makes $80,000 a day. And when you count in those and look at the salaries going to cost, you understand that instead of getting medical services from some of the private for-profit insurance companies, they're padding their pockets and we're getting less coverage. So the health insurance exchange is going to allow small businesses to actually have an option to go in there and shop what we think will be competition based on quality and price. And smaller firms will be allowed early on into the exchange, and then gradually over a couple of years, larger firms will be allowed in if they choose to go. Small firms are going to be given a permanent tax credit to help them pay for this, because we understand the burden that's on small businesses. It could be up as high as 50% of the cost if the business is small enough. We're looking at this as sort of a shared responsibility. We understand that businesses want to pay a reasonable amount, something that they can afford. Individuals are going to have to participate to the extent that they can afford, and the government is going to have to participate on that. For those businesses that are so small it's not affordable, they'll be exempted from any obligation to share costs at all. And then after that, it goes up, but right now we're trying to get the right number about the exemptions and that, but if you currently have a payroll of less than $500,000, there'd be no sharing at all. Over $500,000 to less than $750,000 would be on a graduated fee, but in no event, when you get over $750,000 and up, in no event would be more than 8% of payroll. That means that most small businesses, almost all small businesses, are going to be entirely covered one way or the other, either with a good stipend or tax credit on that, or with being exempted altogether. The effort here is to try to make sure that we don't have a burden being passed along, but people can afford it. I know that in Massachusetts alone, the uncompensated care burden that the hospitals, my colleagues on the panel here will know, the hospitals and other providers are picking up is $44 million worth a year. Under these proposals, we're hoping to eliminate that aspect of the sharing. The other part is we should all know that right now when there's uncompensated care, somebody's paying for it, the providers, as I just noted, are picking up some of it, but the rest of us are paying the tax as well. Those of us that are paying premiums for our health insurance plans, and small businesses most particularly, are paying about $1,100 per person extra to cover the uninsured on that. So we're trying in this bill to understand that small businesses are crucial to our economy. The health care costs impose a real heavy tax on small businesses and have for a long time, and on their employees as well. They high broker fees, fixed administrative costs, adverse selection aspects, all of that is moving in the wrong direction. So we're working on reform down here, hopefully that's going to be preventative care for your healthy workers. Right now, chronic disease takes about $1 trillion of productivity out of our workforce every year. We're going to end those hidden insurance taxes of $1,000 or $1,100 per person for uncompensated care that gets shifted over onto our premiums. We're going to allow people to take that money and reinvest in their businesses again, and it probably can come at no better time than right now when things are so difficult. And that exchange we talked about is going to allow for easy and simple price comparison, as well as comparison on benefits that are offered and the quality of performance. So there will be affordable choices, and several of the states that now have just one company with over 70% of the plans, or two companies, are going to have broader competition, and that should work well to everybody's advantage. The tax credits that we're working on hopefully are going to set the right amounts to make it very affordable, very attractive to everybody. We need to level the playing field. We know that when you're competing with a large company that does not cover their employees, that their costs are naturally down, and yours are up, and even those that do cover it, their administrative costs are proportionally down compared to yours. So the intent here is to help with